Hey folks, Dr. Reistroffer here. I thought I'd take just a moment today to kind of explain what it is we do and what's called upper cervical chiropractic. So when we look at the spine, as you can see just like this, the region that we're referring to is really called the neck, but the 7 bones are comprised of what we call the cervical region. And when we talk about upper cervical, we're really talking about this area here, which is comprised of the occiput, the back of the skull, C1, which is the first vertebra, and C2, the second vertebra. That's the upper cervical region that we work on. And that's where we specialize. And what makes it so special is if we look here, this area right here is so richly embedded with neurological structures that we know there's 450 million nerve fibers that run through there. There's a lot of other things as well, but rest assured, this area is very critical to how the body responds and how it takes care of itself when it comes to regulating the nervous system. So for example, if we pan over one more, if we look at this chart right here, it's kind of a great depiction of what really takes place when we're talking about a misalignment. And why would we want to correct that? But as you look here, if we upset something, we sleep funny or some version of that, instantly we'll have our head tilt to one side and all of a sudden we have what's kind of called a wry neck. For some of us, that may mean a couple days of a neck pain or what we call a crick in the neck. We may take an aspirin or some version of that, but then the body's stuck like this. So then it's going to make some changes with its posture, and then it'll start to move. In this case, it might bring up our shoulder. If not, it'll unlevel the hips. And then as you can see, kinetically, it moves down and pulls and puts pressure in our knees, even in our ankles. So it all becomes relevant. So a lot of times we get questions as to what upper cervical is, and this is us using the technique chiropractically to work on the upper region in the neck. And in doing so, that takes care of a lot of the regulation of the autonomic nervous system. Also, most people don't put the two together, but if this is proper, the posture will change within the spine, also alleviating things like low back pain or even knee pain for those matters. So I just really wanted to be kind of brief today, but I wanted everybody to get a full understanding when we talk about the cervical work that we do, or what we call upper cervical work. That's really what we're referring to and how it can be a benefit to you.